welcome you to this presentation. My name is Ryan Robertson, Dr. Ryan Robertson, and I'm one of the dentists here at RR Dentistry. My passion over the last decade has been discovering and exploring sleep disordered breathing and how it relates to dentistry. And there are many connections. And so what we're going to do over this next hour or so is I'm going to help enlighten you and explore and discover the why behind the diseases that we have, the lack of sleep, the function, the way our faces are, the way our teeth have developed, the way our jaws are, and answer all kinds of questions like, why do we not have room for our wisdom teeth? And why am I not sleeping well? Why am I not breathing well? Why is my child acting up? Why is my child wetting the bed? And so if you're viewing this, you've been given a card with a link or a QR code on it. And I did a separate presentation that was mainly focused on adults. This presentation is mainly going to focus on children. Those of us who are still developing, we're still growing. And I hope to, at the end of this, for you to be educated and enlightened, to be made aware and have your eyes opened to a different reality. One of which I think can be life-changing. And so I invite you to share this with friends, family, help the news be spread. That there is something that we can do. There's something you can do as a parent. There's something you can do as a grandparent. There's something you can do as a friend to those that you see to change their future, to change the way they experience life, to change the way their body compensates. And so welcome. I hope that at the end of this presentation, I've answered your questions, and please feel free to call and schedule any consultations or anything, and I'm happy to meet you, and I might have already met you. You might already be a patient of mine or a patient of the practice, and I haven't. So again, thank you and welcome. Let's get started. So each of us has a very specific combination, just like this combination lock. What do I mean by that? We are all adults because we grew a very specific way. Well, our kids, they're growing a very specific way. They are a unique sequence. Something happens, their body compensates. Something else happens, their body compensates. And so we each, as adults, are layers upon layers upon layers of compensations. Meaning our body has found ways to survive. And it's also true that our body has been impacted by that. Anytime our body, your body, my body, our children's bodies compensate for something, it means that it's not as ideal as what it was supposed to have been. But we still were designed to survive. So what do? We survive. But we pay the price because there's a compensation. And that couldn't be more true than dealing with airway and sleep disordered breathing. Oh, one too many. On the left here is a list of symptoms and results that your child or my child has or other people's children has been impacted. And on your right, these are things that we as adults suffer from. And the research has shown that 9 out of 10 in America, 9 out of 10 Americans suffer from one or more of these diseases. For example, as adults, depression, anxiety, obesity, hypertension, aggressive behavior, bruxism, grinding, cardiovascular disease, atrial fibrillation, Alzheimer's, opioid addiction, diabetes, dementia, cancer, and even premature death. But as kids, this is after a lifetime of compensations. But as our kids, they have nightmares. They wet the bed. They have difficulty in school. They mouth breathe. They snore. They have restless sleep. Their sheets are torn everywhere. They have daytime drowsiness. These things can lead to these things after a lifetime of compensation. So let's ask the question, is Michael healthy? What do you notice about his jaws? This is a profile picture, and if you look at it, you'll notice that his lower jaw is set back. It did not develop forward to keep up with the upper jaw. So his appearance looks more convex. It's very rounded. This young lady, you can notice that her chin is dimpled. Her mentalis muscle is firing. It's contracting to force her to seal her lips. She has dark circles under her eyes. That's called venous pooling. If our upper jaw does not grow and develop the way it's meant to, the skin here is very thin and it shows through the shadowing from the veins that are found in the face. This young guy, his lips are chapped. My youngest daughter has chapped lips all the time, and she suffers from mouth breathing, of which we're actively trying to remedy it. So if you see a child with chapped lips, they're breathing through their mouth, and they're constantly licking their lips because they're dry. This young girl has a slight head tilt. Her eyes are also shadowed. This young lady, the bottom half of her face is underdeveloped. Just look at the shape of her lower face compared to her head. This is very developed. And what we'll see is the lower jaw, the lower face, is not developing in these kids that mouth breathe. You can see her top teeth are more prominent. They're actually sticking through her lips. Her lower jaw is set back, probably because she's mouth breathing. And this young girl just looks tired. She looks exhausted. Doesn't look like she's sleeping well. Doesn't look like she has good rest. And her eyes just don't have that life that we commonly see in kids. So symptoms are like leaves on a tree. When we look at these kids, when we look at your kids, when you look at your kids and other people's kids, you see symptoms. It's what we visibly see and experience. All the things we mentioned, the bedwetting, the restless sleep, the ADD, the ADHD, the crowded, the crooked teeth, the daytime drowsiness, mouth breathing, difficulty in school, chronic allergies, snoring, defiance, aggression. What do all of these things have in common? The underlying cause, what's really happening, is now they have a compromised airway. A compromised airway, the ability for our kids to not breathe and sleep and rest well, leads to all of these things, or it can lead to all of those things. But why do we have compromised airways? Well, we have narrow dental arches, underdeveloped upper and lower jaws. If our jaws don't develop well as we're growing, the airway is compromised. If the airway is compromised, I'm not going to breathe well or sleep well. If I'm not going to breathe well and sleep well, I'm going to wet the bed. I'm going to have restless sleep. I'm going to have sleep issues and nightmares, and I'm going to be drowsy. I'm going to have allergies. I'm going to snore. I'm going to have dark circles under my eyes. I'm going to have swollen tonsils, swollen adenoids. So I have narrow dental arches because why? Could it be that I've only chewed soft foods? My muscles are weak. I haven't developed my muscles. I have a low tongue posture. I had limited or no breastfeeding as a baby. These possible root causes lead to narrow dental arches and underdeveloped upper and lower jaws, which lead to a compromised airway, which lead to the visible symptoms that you and I see in children today. So, where did this come from? Look how narrow. The upper two permanent teeth and lower permanent teeth are the most prominent. The two side teeth are sucked back. The arch looks very narrowed and V'd. You can see from this angle, the lower jaw is really set back. There's too big of a space between the lower and the upper jaw. This is what it's meant to be. We're actually supposed to, in our children, you're supposed to see space between all of the teeth. That means the jaws have grown appropriately. Because pretty soon, adult teeth are going to drop in, and adult teeth are a lot larger than primary baby teeth. And if primary baby teeth don't have space, you're going to be crowded every time. And so you're guaranteed that your child, in order to have developed jaws, will need braces, expansion, all the above. And so there are different approaches to address that. But this is an endangered species. I do not see spaces between every tooth anymore. Well, why is that? I'm glad you asked. We're going to get to that. Is it because we've got large teeth? Sometimes. Rarely is the circumstance that we just have big teeth. Okay. More commonly, it's because we have small jaws. The normal growth that you and I go through and our kids go through is they are meant to be on this inner ring of growth. And as we grow, each of these lines represents a year. And so at 2 years of age, we're on this inner line. By 17 years, we're on the outer line. Where do you see the most growth occurring? That's right. It's happening down here. The skull actually does not grow much. And in fact, 2 years old, 55% developed. By 4 years old, 73 in males and 77 in females. By 12 years of age, 89% and 94% in females of how much our faces and jaws have developed. So catching this in children is much easier to treat because we can expand while they grow. The expansion occurs so much quicker. And think of the compensations. Our kids don't have years upon years upon years of compensations to have dealt with. Normal craniofacial. Cranial means cranium, facial face. So normal growth is down, forward, and wide. Down, forward, wide. So wider, forward, and downward. This part of us is supposed to grow. What is driving that growth? And we're going to get to that. I'm glad you asked. Why are so many children suffering from abnormal growth? Why are so many children that we see, you see, my 2 daughters had this. Why are they suffering from abnormal growth? Well, there's some research by Dr. Corosini, and he's an anthropologist, and he's been one for 30 years. He's written multiple books. I don't have time to go into all of these. We're going to focus on one, and that's the population studies. Population studies. What he did is he went back and he has looked at tons of skulls. 400 years ago, the skulls looked like this. We had room for all of our teeth. They weren't crowded. The jaws were very wide, and the growth had occurred down, forward, and wide. Look how wide that lower jaw is in relation to the rest of the head. Look at today's modern skull. It's much narrower. The arch is much, much narrower. And so what he did when he looked at these populations is he went in to rural populations, isolated populations. And he looked for common themes when studying these rural, removed, isolated populations. And what he found is they typically breastfed for many years. They ate a hard food diet. There was little to no incidence of crowded or crooked teeth or degenerative diseases, meaning things that the body had to compensate for. And they had perfectly formed upper and lower jaws. And there were no dentists and there were no orthodontists there. So, his conclusions looking at these skulls and doing his research is dietary consistency and toughness promote bone growth. Under stress, the jaws grow. Under stress, the tongue causes the jaw to grow. And when non-resistant or soft processed foods became normalized after industrialized malocclusion or crooked teeth, it showed a rapid rise. What that means is that's a very complicated way of saying once a diet, soft food diet, was inserted into the population, crowded and crooked teeth incidences went up. And so soft diet or processed foods, they increase the underdevelopment of the upper and lower jaws and malocclusions or crowded and crooked teeth. And when he looked at these populations, and he looked at populations in the past, and once a Western ideal or a Western culture ideals and ways of living and living life were inserted into these populations, by the first generation, 50% of the population had a rise in malocclusion. By the second generation, it went up to 70%, and by the third generation, 85%. So what generation are you? I don't even know. And I've had braces and malocclusion. My kids have had it. My wife had braces. Most people, to get our jaws wide and broader, need braces to do that because our jaws are underdeveloped. So these population studies by Dr. Corricini, what he also found is most malocclusion is acquired. We acquire it over time. It's not inherited. And malocclusion is a disease caused by Western culture. So what is Western culture, Ryan? You keep bringing it up. I'm glad you asked. Western culture means we are not breastfeeding near as much as we used to. We are actually bottle feeding more. Let me explain. I'm not getting on moms at all. But the reality is, sucking on a human nipple is very different than sucking on a plastic one. A plastic bottle nipple actually trains low tongue posture. And if the tongue is sitting low, as we're about to discover, it's not sitting up in the roof of the mouth. It trains to sit low. And if it doesn't sit up, it doesn't act as the grower of the jaws. The tongue is so important to the development of the face. So if the tongue is sitting low and it's not strengthened, because it's very easy to express milk out of this, it's much more difficult to express milk out of this. This grows the face. It develops the jaws. It develops the airway because the jaws grow forward, opening up the tube. If the jaws don't grow forward because of the muscle activity and it's made real easy and the tongue's trained to sit low, and then we go from that straight into a soft diet, that combination is what leads to underdeveloped jaws, which lead to an underdeveloped airway, which leads to all the visible symptoms that you and I see in our population of kids today. And then we go from a soft diet to an even softer diet, where these things, we suck through applesauce through a straw instead of eating an apple. We suck on a puff that melts in our mouth. My kids did this. So again, please don't hear me say I'm getting on. I'm not. This is the reason why we're seeing what we're seeing. I benefit greatly from working moms. Greatly. I couldn't do what I do without them. And it is the reality of our culture, our Western culture. And so when you see our Western culture take these things and insert them into other populations, eventually their jaws shrink too. They get smaller jaws because they're not developing the way they were meant to. This is the way it should be. And I know what you're thinking. Well, I don't want my child to choke. Neither did me and my wife. So we didn't do this. And there are ways to get around this. Chewing on carrots, chewing on broccoli, getting the nutrients, getting the health, getting the jaws to grow. Nursing as long as you possibly can. Supplementing your nursing with pumping. That's what my wife did. But we only did it for a little over a year. And the research has shown 2 to 3 years of breastfeeding will help the face develop. And by 2 to 3 years of age, then they can go into harder foods. Instead of a year of nursing, then a bunch of soft foods, their faces were forming, and then we stunted the growth by going to soft foods. So there's ways around it. We just got to find the right combination, the right sequence, right? So the body doesn't compensate. So most malocclusion is acquired, not inherited. Malocclusion is unique to the Western culture, and the presence of malocclusion is the key indicator of an underdeveloped airway. So when I or my team or my hygienist look and see crowded, crooked teeth, the first thing I think too is they have a small airway. Their airway is not as big as it once was or could have been because they're body compensated. Okay? Dr. Jameson Wallace, he was a dentist a while back, and he said, he was ahead of his times, an early soft diet prevents the development of muscle fibers of the tongue, resulting in a weaker tongue, which cannot drive out into space the primary dentition. It doesn't fully develop the arches, which lead to more crowding of the permanent teeth. So the tongue acts as a brace. If it's sitting in the roof of the mouth, the jaws grow as our kids grow, creating a nice dome, an arch, not a Gothic arch. We don't want our arches V'd. Look how crowded that is. That child doesn't have a tongue that's sitting there. This has tons of space for a tongue sitting there. Dr. Christian Guillemot is a researcher in Stanford University. He's one of the prominent researchers in dentistry connecting sleep disordered breathing and the role of dentists. And he's saying that dental arch expansion improves sleep disordered breathing. Sleep disordered breathing is a spectrum. At the end of that spectrum is obstructive sleep apnea. At the earliest is snoring. Snoring can lead to furthering and furthering problems, but it's a symptom. Just because you snore doesn't mean you have obstructive sleep apnea. But it can lead to it because the jaws are underdeveloped. If there's noises, that means the air is flapping something because it's too small, it's too restricted. Upper and lower jaw constriction can be a valid treatment. So dental arch expansion, growing the jaws, grows the base of the nose, grows the airway, creating space. Because we want it to look like this and not this. So if we expand it and we develop it, we can grow it into that. Our airway starts at the tip of our nose and goes to the base of our throat. Anywhere where there's a constriction is going to lead to a compensation. Meaning, if my nose is constricted, I'm going to breathe through my mouth. If I breathe through my mouth, I'm not breathing through my nose. If I breathe through my mouth, my tongue isn't sitting in the roof of the mouth, and it's not acting like that expander. Right? And we'll get into more of that. So what does your airway look like? Are you curious? Is it a narrow straw or a nice big garden hose? These are images of airways. So what we can do is we have a CT scanner. We could take a CT of the head and neck region, and I can trace out and measure the volume of an airway. That's what these colored things are. The red means that it's really, really narrow right there. We can also see other clues. We can tell if the tongue isn't sitting in the roof of the mouth. We can see the blockages of the nose. We can see adenoids that are overgrown that make it impossible for that child to breathe through their nose. So this is a video at righttogrow.org. We're going to watch it, and they're going to help kind of package all this together. And she does an excellent job of explaining this process. So let's listen in.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. Adulthood. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition, however, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits.
That's right2grow.org. You can go there and you can view this video, and they have other videos that if you're curious and this interests you, but you can go back and view that at any time. This is a video, it can be disturbing for some, but this is an example, only an example. The mom of this little guy is a nurse, and she recorded him, and I want you to look at the face, the color of it, and then when she actually grabs the jaw and moves it forward, it opens the airway. And she does a really good job of explaining that. But those are just some things I want you to pay attention to.
Now he's holding it. That was holding it. He's still holding it. He's trying to take in air. There he goes. Now watch. He's holding it. He's holding it. He's holding it. He's holding it. He's still holding his breath, and now he's going to gulp again. There he goes. That was it again. And again. He's holding. He's holding. He's trying. There he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had of not getting calm breath in. Now watch what happens when I take his jaw and I just bring it forward. If I can, let's see if I can. And I open his airway. Just bring his airway forward.
Very quiet breathing from that point forward. And so you saw the disruption and the fragmentation of the sleep. He didn't physically wake up, but his brain was having to arouse the system because he was mouth breathing, and he could breathe in, but every time he tried to breathe out, he couldn't. Okay, so that's obstructive sleep apnea. Something is in the way of the airway, disrupting the sleep. He's not getting quality sleep because he's constantly being disrupted because he can't breathe. And so his brain isn't getting oxygen. His brain sends a signal to the diaphragm and the heart, beat more, beat more, beat more. And then he has a catch-up breath. And he's getting flushed and red because his system is working tremendously hard when that's happening. The jaw is falling back. It's constricting the airway. The soft palate is back there. And if the jaws don't develop, they're set back, compromising the airway, leading to the symptoms like leaves on the tree that we saw earlier. So nasal breathing versus mouth breathing. Why is it important, and what is the differences between the two? Dr. Harvold is a researcher at USCF, and what he did is he took some rhesus monkeys and he was curious. He blocked their noses and then he conducted some airway studies, and what he found out is nasal obstruction and mouth breathing, creating low tongue posture, leads to malocclusion. Meaning, if we're not breathing through the noses like we're meant to, and if the tongue isn't postured in the place it's meant to, the teeth develop wherever. The teeth develop in places that they're not supposed to. So he took monkeys, he blocked the nose, they started breathing through the mouth, creating a low tongue posture in the mouth instead of the roof of the mouth, which created a big tongue. Inaccurate. It didn't create a big tongue. It created small jaws. How many times have I heard, I've got a big tongue? That's not an accurate statement. It's that the jaws didn't develop when we were kids or when our kids are growing because the tongue wasn't sitting up in the roof of the mouth. It wasn't expanding things. And so then when the teeth come in, they're trying to crowd in to underdeveloped jaws. Low tongue posture creates an upper jaw that's not expanded, and it creates swollen adenoids and tonsils. Adenoids and tonsils are part of our lymph system. They're the trash can. They help clear up junk. And if we're not breathing through our nose and humidifying and filtering and warming the air to prepare it for our lungs, it can cause swelling of that lymphoidal tissue. Dr. Linder Aronson is another researcher. He took some children and he focused on the difference between nasal and mouth breathing. And his outcome was that mouth breathing children develop differently, and that's what we've been talking about. He observed that nasal obstruction, kids' inability to breathe through their nose, leads to mouth breathing. It's a compensation, remember? And lower tongue posture, compensation, which leads to higher rates of malocclusion. So crowded and crooked teeth is just our body's way of compensating because the tongue wasn't sitting up, it's actually sitting down. And we're mouth breathing. So how do we promote nasal breathing? Nasal breathing picks up nitric oxide in the nasal passages, distributes through the body, dilates our blood vessels, increases oxygen intake. There are functional appliances that our kids wear that they use to strengthen their muscles and train their tongue to sit up in the roof of their mouth. I want to switch gears here, and just one of the visible symptoms that we see is aggressive behavior, defiant behavior, and at times diagnosed and has a similar symptom category as ADD or attention deficit disorder. Here's a video that's going to kind of help connect some dots and tell a story, okay?
Take a child, alter their quality of breathing and sleeping, and the real big issue now is how will they be during the day? So now you take a child who's 5, 6, 7, 8, it doesn't matter. Their issue has begun years ago. So it's not like you had 1 or 2 bad nights of sleep. You've had a poor quality of sleeping and breathing for years. And the parents have been struggling with so many different issues, and not the least of which is the ADD, ADHD discussion. Because the child who doesn't get a proper night's sleep with a good quality of breathing throughout the entire night is going to wake up and be unrested. And when you get a child who's had a poor quality night's sleep, poor breathing all night long, and you make that happen for years, you know what you've got? A 6, 7, or 8-year-old that's going to go to school and have trouble learning, have trouble sitting still, have trouble behaving, have trouble cooperating, basically have trouble fitting in to what is supposed to be a quiet and peaceful learning environment. And it's not long after that where the phone call comes to the parent. And when the phone call comes to the parent from the school, what happens is, we have little Jimmy here and he's a little bit disruptive and we really want you to have him evaluated for ADD and ADHD. They're going to be diagnosed with ADD and ADHD. And our solutions are pharmaceutical. If we are given a pharmaceutical, it's usually in the form of some sort of a stimulant. And what that does to the child is it kind of pushes them over the edge and it brings them back to calm. So you basically take an excited or hyperactive child, you stimulate them more, and you bring them back to so-called calm, but it doesn't make a better learning child. You're not going to have a child who's able to learn as well. So now you might have the child sitting still in class because they might be a little more numb or relaxed or calm, but it doesn't necessarily make them a better learner. If we have the so-called ADD, ADHD diagnosis, we're talking about hyperactivity. We're talking about all of the things about behavior and development that land in this category. And the interesting thing about research is, and there is current, ongoing, and past research that shows, children who are sleep deprived produce the same exact symptoms as kids who are diagnosed with ADD and ADHD. In fact, there's a nice study that showed children who were diagnosed with ADD and ADHD were mixed with children who were sleep deprived. And in that group of kids, when they tried to analyze them and look at their symptoms and diagnose them, they couldn't tell them apart. And if you have a group of kids and you can't tell apart who's an ADD child and who's a sleep-deprived child, it's no surprise that maybe the ADD and ADHD has a cause. And maybe that cause has to do with the quality of the breathing and the sleeping overnight. And there's a lot of research out there. One of the pioneers here is Dr. Stephen Sheldon out of Lurie Children's Hospital in Chicago. And he does a wonderful job of researching, and over the decades, he's come to a conclusion, and I've seen him speak, and it's not soon after he jumps on stage and he makes a statement that ADHD and ADD do not exist. They are an outcome of a sleep disorder breathing. They're an outcome of a poor quality of sleep. It's all about the quality of sleep. Another researcher who's produced beautiful research on the same topic is Dr. Karen Bonnick out of Einstein at Yeshiva University. Dr. Karen Bonnick has the largest study to date. 11,000 children were watched over 7 years. And they were divided into 2 groups, sleep disorder breathing children and children who do not have sleep disorder breathing issues. The children in the sleep disorder breathing group, over their 7 years, her study showed that they were 50% more likely to be diagnosed with an ADD or ADHD diagnosis and treated with medication. 50% is a coin toss for our child to be diagnosed and treated with a medication. Also in her group, they were doing testing. They were doing IQ or intelligence testing along those 7 years. And the children with the sleep disorder breathing, their intelligence testing, their IQ scores were dropping over those 7 years. And that's really not the way it works when you're growing and forming. The formative growing years for a child, when they're sleeping and breathing well, your IQ raises to a certain point, and then you kind of plateau. We don't see IQs diminishing amongst children.
Dr. Morali does a great job of explaining some of the connections between sleep disordered breathing and a diagnosis of ADD and ADHD. This is the research that he was referring to. Dr. Karen Bonnick, 11,000 children over 6 years, peer-reviewed journal, Pediatrics of 2012. Her findings are there is a strong and persistent association between sleep disordered breathing and diminished IQ. Sleep disordered breathing increases the risk of an ADD, ADHD by 50%. So if you know of a friend, or if your child, or if you know of somebody that is looking for an ADD, ADHD diagnosis, it would be helpful to rule out sleep disordered breathing, because it could be sleep deprivation. It could be fragmented sleep. It could be lack of oxygenation. Sleep deprivation, as opposed to true ADD, ADHD. Bedwetting is another thing that's very common in kids that suffer from sleep disordered breathing. And Dr. Morali, I think, does an excellent job of explaining the connection of why we see it more and more and more in kids with sleep disordered breathing.
Another thing that might happen is bedwetting. Bedwetting, it's a little more common than people are aware because it's also a best kept secret. Not many people are running around and advertising that their child is bedwetting at the age of 5, 6, 7, 10, 14 years old. But bedwetting does have a relationship to how we're breathing and our quality of sleep. And some of the causes for bedwetting relate to the way oxygen is exchanged in our body. And the way I'll describe it is this. If we're breathing through our mouth, that air coming into the lung isn't really filtered, warmed, or humidified appropriately, and the body can't exchange it appropriately. So a little less oxygen goes to the brain. Now, the brain is a very sensitive organ. When the brain recognizes little changes in oxygen, it goes to work immediately. Because once the brain starts to recognize a little less oxygen, it doesn't know if we're being choked to death, a very serious condition, or if there's an imbalance in how we're breathing at night. But it does start to trigger a little bit of the fight or flight response. And a little bit of the fight or flight response means the brain's going to look at the body and say, all right, if we've got a little bit of an oxygen issue going on, I'm going to pull oxygen from something that it picks to be unnecessary right now, and maybe deliver it somewhere that might be more important, planning on the rare occurrence as if the oxygen was going to stop. So if the brain's recognizing a little less oxygen, all of a sudden it's pulled from the urinary tract. If the body pulls a little oxygenation from the urinary tract, it might void, so we might wet the bed.
So what can we possibly do? Our kids need our help. They need our advocacy. Our friends, our community. So what can we do? And it may not be what you think. Connor Deegan is a young man whose mom was at her wit's end. And so they have a story to tell, and we're going to share it. So what's the role of dentistry? I find my role is to explore, recognize, and uncover, and ask some different questions. So I know if teeth are crowded, the airway is too small. And growing the jaws will grow the airway. And there's so many symptoms that are the result of underdeveloped jaws and an underdeveloped, compromised airway. We know the root cause of it now. We know why our jaws are not developing. Changing culture, oof, that's a big one, right? So let's start with recognizing it in our own kids and the kids of others so that they don't turn into adults where there's still treatments and we can still fix things, but the fixes take longer periods of time. And life's more complicated when we're adults. So, what are our options? If your child has sleep disordered breathing, sleep apnea, we first got to find that out. So, options are, there is a PAP machine, positive airway pressure. We still use it on kids and adults. It splints the airway open. There are mandibular advancement devices. We don't use these much in children. We use them more in adults because in kids, we can grow the jaws much, much easier. We can develop the jaws much easier. If the adenoids and tonsils are swollen, we can remove them with a referral to an ENT. We can train the tongue with myofunctional therapy. There's Vivos appliances, functional appliances that help guide the growth of the jaws in kids. It's a series of appliances. Vivos also makes adult appliances that are prescribed by your dentist, by me, because they're very, very specific and they have a specific end in mind. So for kids, we want to prevent the problem, but once the jaws stop growing, we control the problem or resolve the problem. So which option is right for you? What sequence, what combination is right for your child? Do we want to address the root cause as a child, or do we want to wait for their adulthood? I would encourage you to address it as a child. Less compensations, less health issues, less problems. We want to grow the airway. We want to grow the jaws. We want to grow the bone. And then, do we position the teeth? Yes. Do we control and wear a machine or appliance? That might be the right situation or the circumstance, depending. We've got to explore that. So what's the right combination? Children are still growing. We expand them. We use guide oral appliances. We can use braces, myofunctional therapy, tonsils and adenoids removal. If we're going to control the problem as adults, we'll use PAP therapy, mandibular advancement devices, nasal dilators to help the nose not collapse, breathe right strips, and medications. But if we want to resolve the problem, and prevent it from happening in our kids, and resolve the problem and lessen its impact on us as adults, we can do nasal surgery, jaw surgery, remove the tonsils and adenoids. Vivos appliances are the only appliance that has an end, so they grow the jaws non-surgically. We can grow the airway, we can grow the jaws, orthodontics, and move the teeth. Hunter's, let's go through some cases. This is Hunter, he's 10 years old. This is his before, this is his after. You can see there are adult teeth that are coming on the outside. That means his jaw is too small. Teeth are trying to drop in and they've run out of room, so they're coming out sideways. After we functionally applianced and went through a series, his teeth have been guided into place. 10 months to get there. He stopped wetting the bed just after 1 week because he was sleeping better using these appliances. This is Paige, she's age 11. This is her before, this is her after. You can see, again, her arches are narrow. Her teeth didn't have room. Look at how her bite is deep, meaning her top and her bottom teeth, they overlap one another. Look, you can barely even see the lower front teeth. Now look, her jaws grew. We encouraged the jaws and grew the jaws and guided the jaws into a better relationship. This is Michael. He's the young man that we saw in the profile picture at age 9, age 14. Profile of Michael, age 9, age 14. Developed jaw. Before. After. This is Michael's airway. So this is called a cephalometric x-ray. And you can see the dark line. That's Michael's airway because his lower jaw was set back. Now look at his airway. He still does not have room for his wisdom teeth. He's going to have those pulled because his jaws didn't develop the way they were supposed to, and now you know why. Soft diet, Western culture, all of those things. So, if only I had known. What about my child, my girls, my daughters? Both have benefited from functional appliances. Both have had expanders to expand their upper jaw because their jaws didn't develop the way they were meant to. What about my spouse? He snores, she snores. I can witness them stop breathing. If that's the case, seek help, please. You will be better and healthier and live longer if you're not suffering from lack of sleep and sleep disordered breathing and sleep apnea. What about me? I'm going through active therapy with Vivos appliances myself because I want to be better. I want to be the me that I'm supposed to be. This is Tara Griffin. She is a dentist that went through the therapy. She was her first dental patient or first Vivos patient. She's going to tell us her story. Her life was transformed and her practice.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the Vivos appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well, waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the Vivos appliance. As soon as I started treatment with the Vivos appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the Vivos appliance, My smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the Vivos appliance is worn in the early evening while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs. And we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the Vivos appliance, if this would be good for you, then I recommend you coming into a Vivos center to be evaluated to determine if this is something that can help you.
It's Dr. Griffin and her story. Pretty powerful. Her life was changed as a result of it. This is her airway. This is why she experienced what she experienced. This is why her TMJ pain went away. This is why her face was different afterwards. She went from an airway of 7.7 centimeters cubed to 24. So almost 3.5 times as big. 120 cross-sectional to 276. You could just see the colored outline of her airway on this lateral view of a CT scan. Very, very narrow and much more open. This young lady went through treatment. If you're curious, is this going to change my appearance? Slightly. You saw Tara Griffin. This young lady, you could see facial changes. It's not drastic, very, very subtle. This young lady wanted to change her gummy smile. She could have done it surgically. She chose non-surgical with Vivos appliances. Her profile changes. It's more upright. Her facial features change, and this is what she has to share. When smiling, I notice that I am now physically unable to smile as big as I used to. My gums are now barely showing. My face feels different when I smile now. I don't know how to explain it, but it is a great thing. When I speak and eat, my jaw no longer pops. I can speak more clearly and feel a noticeable difference in the amount of room my tongue now has. I can breathe very well through my nose now. I am very happy with the results. So the Vivos system, what is it? It's appliances that fit into a system. We want to promote nasal breathing. We want to strengthen and train the tongue to do what it's supposed to do. And we want to eliminate bad habits in our kids. So, through appliances, the child will be trained to breathe through their nose. Through myofunctional therapy and the appliance that trains the tongue to sit up and repositions the tongue, that will in turn eliminate the bad habits. In adults, we do something similar. We still have to train the tongue. We still have to promote nasal breathing. Not very often are there still adults having habits like finger digit sucking, thumb sucking, sometimes nail biting, but if there's a tongue thrust, we have to break that habit. And there are just things that we do, compensations that we have to uncover. So what do? We have questionnaires, we take a CT scan, and we generate a report. And we have a baseline of values that we get. After you go through, midway through treatment, we take some more records because we want to see how much the airway has grown in adults. We want to see how much the jaws have changed in our kids so that we can measure and quantify the differences. There are appointments throughout the process where me and my team will guide you through it. There are different appliances depending upon your individual needs. It's very integrative, so if there are some surgical approaches that are needed, I work closely with ENTs and oral surgeons that can help us get there. Here's a video where Dr. Bennett is a dentist that has been providing Vivos for a while. He helps package some things, and then the CEO also gives some words. Now, I'm not here to sell you Vivos. I'm here to educate you. Any and all of these options can work. It depends upon what's right for you and what your goal is. The functional appliances for kids are great. They're easy. Compliance is needed. But all therapies are on the table. There is some that are better for you than not. We can explore those together, but let's listen.
Vivos is one of the great answers to the healthcare crisis that's in America, because we're getting to the root cause of what ails a lot of us, and that is not breathing well and not sleeping well.
If you trace back the journey of a sleep apnea patient, that patient is suffering for years before they ever get diagnosed. Once they are diagnosed, they're presented really with two fundamental options. You can go into CPAP and wear a contraption over your face every night for the rest of your life, or you can have what's called a mandibular advancement device, which will actually protrude your lower jaw in an unnatural position to hold your airway open while you sleep, and you can wear that for the rest of your life. Either of those two modalities are going to present that patient with a life sentence of having to wear this contraption, one or the other, every night for the rest of their life.
The interesting thing about CPAP and oral appliances is, although they're very effective treatments, if they're used over a lifetime, the person's condition actually gets worse over time.
Along comes Vivos and says, wait a minute, we have a better option that's all natural, non-invasive, non-pharmaceutical. We can say to a patient, you go into this oral appliance therapy with our protocols, and you go through this treatment for 12 to 24 months. And at the end of that time, there's a high probability that you will no longer have to wear an appliance or any kind of device.
Vivos is literally changing my patients' lives.
It has drastically changed my life. I don't have to use the CPAP anymore. Within just a couple of weeks of using the appliance, I was able to breathe through both nostrils, something I couldn't do my entire life. This was revolutionary. Pretty much made me feel excited about life again.
She's sleeping better, I'm sleeping better.
You really feel like you've been given a new life.
It's amazing. I wake up and I'm not in pain.
Because she's sleeping better, is her attitude during the day is better.
I have a better quality of life now. I can't say enough good about it.
I'm getting instant benefit from it. I was amazed. I dreamed every night for 2 weeks straight, and I told my wife, I said, it's amazing. I feel sharp now. I don't feel drowsy all the time. It's been a long time since I felt this good. I wouldn't lay down and try to sleep right now without my Vivos device.
My asthma has gotten much, much better. Without the Vivos, I wouldn't be outside right now. There's no numerical value you can put on this kind of a change. I smile. And I haven't smiled for a long time.
Right after I started using it, I noticed the results really, especially with the snoring. My sleep apnea episodes are a fraction of what they were before. This product's phenomenal. It changed my life.
It's a very comfortable process, but I can see dramatic differences. Now I can really open my mouth. Before it would almost always click.
His ADHD is calming down, he's doing better in school. I can definitely see the difference and the change in him. It's a miracle.
I get to do things now that I would not have been able to. I would not hesitate to do it again.
I am 100% happy that I did this, and I'm thankful every day that I have it because I can breathe.
We bring hope to the millions of people and the millions of families, men, women, and children who suffer from this disease.
It promotes the body's own ability to heal itself, because now the body can breathe and sleep well. That's exciting.
So what's next? You've heard the why, you understand what's going on, and you're curious, possibly. So what do we do next? Options are you can have a 45-minute consultation where we do a 2-night sleep screening to see what's going on. You want to explore what's going on? We usually will take a CT scan to view your airway and find out what does your airway look like. All of that's included in the 166. If you do the consultation as your next step, and you want, and I let you know, yes, Vivos will work for you, then what we have to do is we have to gather data, we have to gather information, we have to get a baseline of all the information. So that takes about an hour and a half. We do a 2-night sleep screening. If we didn't do it here, but we always do it here. We'll take a CT scan if we didn't do it here, but we usually do it here, because I want to view your airway. We will take intra and extraoral photographs. We will give a detailed examination along with a rescue appliance. Now, what's a rescue appliance? If your child comes in and we see this and you fill out the questionnaires and we see that there's a high probability that's going on, I don't want your child sleeping another night without something. Okay? So if you go forward with the Vivos system, we deliver a rescue appliance that day to start breaking some of the habits and strengthening the oral muscles. Okay? So that's why they're divided out. We always do this first. We do a sleep screening. But if there's a high chance that something's going on, a lot of times we'll provide a rescue appliance so that your child doesn't sleep another night suffering. For adults, a lot of times what we'll do is we can do a PAP machine. The cost varies depending upon medical insurance. We can also use a mandibular advancement device for adults. These are non-surgical approaches. It's $2,500 for 3 months. So what we're doing is we're preventing the jaw from falling back, splinting the airway open, but I've got to measure the effects that the jaw position has. That process takes time. Unlike in a sleep lab with an attendant attending your sleep study, they're doing a sleep study and they're measuring your obstructive apneas. And so they will measure the pressure while you sleep on your breathing machine, on your CPAP machine, or BiPAP or AutoPAP machine, to make sure that all your events go away. So it takes a little bit more time with an oral appliance. Both work, just depends on if you want to control the problem. If you want to resolve and wear an appliance and do it non-surgically that will grow the airway, we grow the airway non-surgically, splitting the airway open and grow the bone. So Vivos, if you choose to do it, for kids, it's $3,500 to $4,250. $3,500 covers the appliances, myofunctional therapy, tongue tie. It covers. It's a kind of like a balloon or an overarching. Okay, it takes care of the things because we got to catch your child up. The reason why it could be $3,500 to $4,250. $4,250 is if we've got to catch up your child. They're behind on growth. So if we've got to expand them with fixed appliances to get them caught up to where the Vivos guide appliances take over, then that's what's necessary. For adults, it's $8,500. The treatment is typically 12 to 24 months, somewhere in there. It depends upon how much we have to grow, how much airway we want to realize. Myofunctional therapy, strengthening the muscles, that's included. Tongue and lip tie releases if we need to do it. You've got to wear these appliances. For kids at nighttime and about an hour during the day of active treatment, clenching into the appliances. For adults, you've got to wear it at least 12 hours. It's ideal to wear it 16 hours a day. You've got to have these appliances in your mouth, growing your maxilla, growing your airway, growing the base of the nose so that you can create more room to breathe. So, this is a lot of money. Yes, it's not a lot of money compared to surgery. It's not a lot of money to change your life. It's not a lot of money to grow your bone. Okay? It is very much compliance dependent. You've got to partner with us to help you. If you don't wear the appliances, it won't work. Vivos appliances are the only appliances which have an end to wearing them because we're changing the bony structure. The majority of cases will benefit from some form of orthodontic work at the end. So you're going to pay me and my team to grow your airway, but now your teeth will have some spaces because we've grown, we've increased the arc, we've increased the dome, we've blown air into a balloon and now it's bigger. But now there's space between the teeth. So we either consolidate the space to areas where you can't see it, or we orthodontically close the space by bringing the teeth forward to close the space, or we can restore them, meaning I can put something, make the teeth bigger so now they fit together. We've got to get your airway and your jaws right, and then we align the teeth. So, what is your combination? It is unique to you. And the earlier we get to this in your kids, the years of compensation will not occur. The health issues will not layer one on top of another on top of another. Because as Dr. Bennett said, we're going to use your own body's ability to heal and restore itself by taking the full potential of every minute, moment, and hour of sleep. Because if we can get you sleeping well and breathing better, a lot of what you and I suffer from will be minimized. I can't guarantee perfection, but I can guarantee improvement. What level of improvement, I don't know. And that's part of the journey and the exploration. I want to thank you for listening to this. Your next step is a consultation where we get a scan to see your airway, and you go home with a device that I screen your sleep for a couple nights so that we can see what's going on. We can see where we start and see if you're a candidate for this and answer any questions you might have. So give us a call here at the office, RR Dentistry, RR Airway Health here in Georgetown, Texas. I want to thank you again for listening in. Please feel free to share this with anybody that you know that could benefit from this, whether they're parents or you adults, other adults that you know that suffer from sleep disordered breathing and obstructive sleep apnea, because the underlying cause is growing the airway, growing the bone, growing the jaws. If we get them bigger, the airway will get bigger. If the airway gets bigger, you'll breathe better, you'll sleep better. If Vivos isn't right for you, that's okay. What I can do is I can point you in the right direction, or we can give you the contact information for sleep physicians that we work with so you can have an attended overnight sleep study and go the CPAP route or the oral appliance route. So I appreciate your time and thank you again. Best of luck to you on whatever path you choose. Thank you.